This story shows the importance of getting an accurate potassium test result on blood. Mindy suffered from drug abuse and lost her job as a housekeeper. When she ran out of money, she was evicted from her apartment and became homeless. One day, her right leg began to swell up. She was able to tolerate the pain for many days, but when it became unbearable, she went to the ER. In addition to wound cultures, her doctor checks her potassium level in her blood. Getting an accurate potassium level is essential for patients like Mindy. The normal value is between 3.5 and 5. If the potassium is low, the mortality risk can double. If it's high, the death risk can go up 8-fold. Symptoms of low potassium include muscle weakness, spasms, and fatigue. Patients with high values can have shortness of breath and an irregular heart rate. Today, testing for potassium in blood is conducted in 2 ways. The most accurate test is to have blood sent to a clinical lab. It takes 45 minutes as it must first be delivered to the lab and then spun to produce serum. In an emergency, results can be obtained within 5 minutes using bedside instruments that measure potassium directly from whole blood without centrifugation. Red cells can be damaged during collection and transport. This releases hemoglobin, a protein that is red in color. Potassium is also released and produces false high values for this mineral. When serum is tested from a clinical lab, hemolysis can be detected by the presence of the red color. When present, a notification is attached to a report alerting doctors that a false increase has occurred in tests like potassium. In this situation, the medical team usually repeats the test by collecting a new blood sample. Unfortunately, when unspun blood is tested, the dark red color of blood obscures any hemolysis that might be present and no alert is provided. Mindy's potassium was normal. The astute doctor suspected that her sample was hemolyzed and that her actual potassium was low. Homeless patients often have low results due to poor diet and through gastrointestinal losses. Low potassium weakens the immune system and makes infection worse. The doctor asked for a recollection of blood, but by then, Mindy had left to tend to her dog Abe, whom she had left with an unreliable friend. A few days later, Mindy returned complaining of muscle cramps and weakness. Her infection had become necrotic. The inability of the doctor to get an accurate potassium result when she was first initially seen led to an ambiguity of Mindy's level, which resulted in a delay of her diagnosis and treatment. Mindy recovered from her infection with treatment. Later, she received rehab for her drug addiction, found employment, and was soon off the street. Abe was with her every step of the way. New whole blood potassium analyzers will be released soon, which enable rapid hemolysis detection without having to send samples to the central lab. Stay tuned for more lab tales.